8:11 now, Steve and Ted. It's time for Wednesday with Wagle. Dr. Jason Wagle at Kansas Perio and Dental Implants. Good morning, doctor. Nice to have you with us this morning.
Good morning, Steve. Thanks for having me.
You know, obviously, the big topic, everybody's mind, everybody's lips, COVID-19 and the risks involved. And so what are you doing to reduce infection and flatten that curve at Kansas Perio?
Thank you for asking that. Bottom line is if everyone continues to follow the CDC guidelines, which is, quote, the 15 days to slow the spread, then we have a better chance of flattening the curve sooner rather than later. The 15-day period started on March 16th, so we still have a few more days to go with this protocol before any new guidance is issued. Really, we're all in this together. Kansas Perio is following the state and county health and environmental guidelines to protect patients and reduce the load on the hospitals and emergency departments.
And if somebody wants some more information about this, they can call you, and you've got some pretty good information there. At what? 6?
Hey, you know what? Yeah. Bottom line is we are following. Our infection control guidelines are very strong. We're limiting the number of patients being seen, but we are here for urgent needs and to answer questions and to set up future appointments. Feel free to call us at Kansas Perio, 316-685-2731. And I would like to emphasize that, Steve. Since we are seeing fewer patients, we do have more time to talk on the phone.
Yeah.
So if you have questions, call us at Kansas Perio, 316-685-2731. Either our staff will answer questions, or you can leave a message, and maybe one of the doctors may call you back.
Yeah, that sounds good. Well, hey, what are the symptoms of this virus, by the way?
Well, I think that a lot of people have been talking about this. It's kind of somewhat, maybe you may or may not know all this already, but essentially it's, you may have a runny nose, or it may start off with a sore throat, or usually then turns into some type of congestion and fever, and then a dry cough. People call it a dry cough. You may have some fatigue as well associated with it, but, in severe cases, it can involve difficulty breathing.
Yeah.
And that's when you really need to start seeking medical attention. But
I seldom have a fever, but is fever one of the keys to this thing, having a high fever?
The fever of like 100.4 is what they kind of say, and that is kind of an indication that you may have it, or then becoming serious. It's one of the first signs of it becoming serious. That's true.
I don't know if you've been listening, but Shelley and I went out looking for vitamin C last night. I take it religiously. I take a tablet every day and a half for years. Apparently, there's been kind of a run on vitamin C. What do these people think that's going to protect them somehow? What do you think?
I think I've been hearing a lot of things that, like it, ultraviolet or vitamin C or things like that. I think that, you have to kind of probably go to the CDC website. There's a lot of myths about the virus. But essentially, I would say I think vitamin C might help improve your immune system. Maybe make it stronger. But will I say will it cure coronavirus? Probably not.
All right. Well, listen, thank you for that offer to kind of be an information line there at 685-2731. We appreciate that. And you stay safe, will you? We want you to be okay. Okay?
Yeah, we're good. And thanks for letting us visit with you today.
Keep washing. I know you wash your hands already, so there you go.
Oh, yeah.
Hey, when it's time to get serious about your smile, time to go see your dentist about Kansas Perio. Learn more about their services online at kansasperio.com, or call that number if you have you need some information. It's 316-685-2731. We call it Wednesday with Wagle. Dr. Jason Wagle, Kansas Perio and Dental Implants. I thought it's really helpful to have somebody who knows something about the medical field, have them on live with us like that to maybe give us a little bit more information. All right, Ted, it's coming up on